This being at home during the pandemic has led to a lot of problems. Drinking during the pandemic has increased to cope with a lot of those problems. And now some studies are saying that excessive drinking has led to a spike in the request for liver transplants. And joining us now is Dr. Bankole Johnson. He is a physician, a psychiatrist, and chief medical officer at Adial Pharmaceuticals. And Dr. Johnson, as always, thanks for being with us. I was stunned at this. Has excessive drinking actually caused another type of pandemic?
Absolutely. In fact, I think that we moved from one pandemic to a double pandemic, which is the COVID and flu, and now we've moved to the tridemic. And the tridemic adds alcohol use and the use of other substances to it, which is really quite a shame. We have a terrible national health crisis at the moment.
I know I gained a lot of weight during the pandemic. A lot of us have. We called it, what is our COVID-20 or COVID-15 in the beginning. Now it's 20. Some say 25. But what causes people to drink more during a pandemic?
Well, it's a mixture of factors. The most important factor is social isolation. I think that we all drink in moderation when we have people who are able to monitor our drinking, or we have other social norms to be able to regulate our drinking. If we're simply sitting at home and we don't have much to do and we're watching television, and we have all the stress of being at home, trying to look after children, trying to look after husbands or looking after wives, all that stress means that alcohol is a release. There's nowhere else to go. You can't go to bars. You can't go to, socialize with your friends. So the social isolation is an important one. The second has been the reduction in access to care. If you're at home, you're not getting care if you have an alcohol use disorder. So you really can't go and visit with your family practitioner effectively. The third has been that there has been an increase in other types of mental disorders associated with stress, including depression and anxiety, and that has combined to increase alcohol use disorder.
I was waiting to hear you talk about those British pubs that you're so fond of, but we'll talk about that on another show. But that being the case, I'm old enough to remember when, if you were a broadcaster, you were not allowed to bring a glass up to your lips and take a sip of actually alcohol. Alcohol advertising was banned on television. During the pandemic, the one thing that I noticed is that we are being bombarded of images of people drinking. It seems like everything somebody gets ready to do, they walk over to the bar, they pour the drink. That is not by accident. The commercials are not by accident. Is part of this pandemic that we're seeing with regards to excessive drinking caused by the fact that right now the alcoholic beverage companies can do whatever they want to when it comes to what we drink and how much we drink?
That is a very clever and astute observation. Not only has there been an increase in advertisements which are more prolific in touting alcohol use, we've also had a large number of movies do that. You know, the movies, we had a restriction on movies during the pandemic because people, I suppose, could shoot enough movies or TV shows. But a lot of the ones that were coming out really glorified alcohol drinking and glorified socialization, isolated or great drinking, which is very interesting indeed, because we haven't normally spent a lot of time understanding the full impact of different types of advertisements on drinking behavior. And now I think that there is a real need for the regulators to take a look at some of these advertisements, not only advertisements paid for, but covert advertisements inside movies and television shows that are advocating the use of alcohol, especially underage drinking.
Alcoholic hepatitis is caused by excessive drinking. What are some of the symptoms of the disease? What should we be looking for?
Well, individuals who drink too much, first of all, develop what's called a fatty liver. So that means that there is the liver becomes less active, and therefore it develops a lot of fat. And that is usually associated with, first of all, very mild symptoms, gastrointestinal upset, sometimes nausea. Some individuals may get diarrhea, and some people may actually have some vomiting. That then moves on to a stage in which the liver becomes further damaged, When the liver becomes further damaged, individuals may have more serious symptoms. They may become jaundiced, which means they look yellow. The jaundice impairs other organs. It affects the heart particularly and the kidneys. So the person may develop kidney failure or reduced renal output. The person may also suffer a heart attack or begin to develop symptoms as if they have heart disease. And finally, there's end-stage liver disease in which the liver shuts down completely. The person is unable to process toxins in their body, and this is associated with a catastrophic failure of multiple organs and eventual death if there isn't a transplant.
Dr. Johnson, a lot of people are going to be watching and they're going to be saying, you're not talking to me because all I have are a couple glasses of wine, a couple beers with my meal. Who would be classified as being at risk? Who should be looking at their behavior and saying, maybe I need to pull up?
That's a wonderful question. I think anyone who is drinking more than one drink a day, who is a lady, and a man who's drinking more than 2 standard drinks a day, and who is a man, is drinking excessively. And obviously, if you drank all your alcohol requirement or your alcohol allotment for a week, which means that you drink 7 drinks or you drink 14 drinks at one go, you're definitely drinking excessively or binge drinking. And so one of the ways to monitor your drinking is to be able to count how many bottles of alcohol there are out there, in your trash can, to be able to monitor it or even to write it down. It's important to write down and to monitor your drinking because it's possible for this to get away from you. And you think you've only had 1 scotch and you really had 2 or 3 scotches or 3 or 4 glasses of wine, and you say, well, it's only this week's happy hour, but it does have a cumulative effect.
My British friend, I will leave it with this. Warm beer is terrible regardless of what the British say.